All right. Well, good afternoon, everyone. Thank you for joining us. Tiffany Kearns, CMA, here, and I am really excited that a dear friend and longtime partner of CMA, Tatum with Music Health Alliance, has joined us for a topic that I think is top of mind any year for us, certainly for her, but certainly for CMA, our members in the industry at large. But something that we're particularly, paying attention to this year, because the one thing we want to make sure that our industry has going into 2021 is healthcare, and that your options, you're positioning yourself in a way that allows you to be heavily informed and incredibly educated on what options you have when it comes to healthcare. And there is nobody in the business better than Tatum to kind of explain everything to us in a way that we can actually absorb it and understand it. So thank you, Tatum, ahead of time, because I learn from you every time I hear you speak, and I think that's a testament to how you break down the information. So I will kick it off to you. Of course, I'll mute myself. If there's anything you need, just holler. But thank you so much for giving us your time. This is incredibly important to us always, but especially right now.
Well, thank you. I'm happy to be here, and I'm looking at the attendee list, and I see so many old friends on this list. So I'm glad you're here. This will be the most unsexy webinar you will ever have. There's going to be a lot of information, and we're just going to go through it. But what I can guarantee is that you're going to leave with a lot of facts. Hey, Tiffany, can you enable screen sharing?
Yep.
Because what I want to do is share a PowerPoint that we'll click through that just has a lot of data on it. So
okay, you should have that.
I got it. Perfect.
Cool.
All right. Whoop. Okay, are y'all seeing What the Health? Can you see that?
Yep.
Okay. All right. Welcome to What the Health. What we're going to do is, this isn't about politics. This is about facts, not fiction. The goal is to really simplify the chaos of the Affordable Care Act and what it means in Tennessee, and how to remove barriers for you. Music Health Alliance is a nonprofit based here in Nashville, but we work across the nation. And our mission is to heal the music by providing access to healthcare for anyone who makes a living in the music industry and their families. All of our services are free. We're all from the music industry, and we're here to serve you. And it goes back, I mean, the whole reason Music Health Alliance was created was because I was almost bankrupted by medical bills 18 years ago when I had twins, and I had health insurance and a maternity rider, and I left the hospital with a $500,000 bill. And that perpetuated 10 years of research and development until finally there was a place to build a true nonprofit. So I cashed in my 401k, and here we are. So 8 years later, almost 8 years later, we have now have about 13,000 clients across the nation, and we've secured now with COVID almost $56 million in healthcare cost reductions for our industry. We've built this template ourselves. It changes daily as healthcare changes, and we want to continue that. We're a small operation who can really affect change on the frontline level with all of us on a daily basis. So here we go. The goals of this workshop: we want you to understand your dates and deadlines, what is and is not health insurance. That's a really important one. We're going to go over just the basics of health insurance, what your options are in Tennessee, income reporting for the Affordable Care Act, what your options are for 2021, how to enroll, and then we'll touch on Medicare, group health insurance, and then a couple of health hacks. And I'll send this out to everyone. I'll send it out after the session just to make sure you have it in black and white so you don't have to take a bunch of notes. Okay, big enrollment dates to remember. For Medicare, if you're over 65 or you have a disability that qualifies you for Medicare, October 7th through December 7th is your enrollment window where you can change your supplement or move to an Advantage plan. What we're going to focus on today is the individual and family enrollment in the private market sector. That window is November 1st through December 15th for most of the states. There are a few states that offer extended enrollment, but if you want a health insurance plan to start on January 1, 2021, you'll need to enroll by December 15th, 2020. And that's for any plans that will begin January 1. And as we go through this, y'all feel free to ask questions or submit a question on the chat. I definitely want to make sure your questions are being answered. So I'm going to zip through a lot of this information in hopes that we'll have the opportunity to talk and answer questions before the end. So what is health insurance? We're going to go back to the basics really quickly. It's a contract between you and the health insurance company. So you buy a plan, and that company, like a Blue Cross, agrees to pay part of your medical costs when you get sick or get hurt. So there are a lot of words that are thrown around and used interchangeably when they really shouldn't. So here's just a little glossary to get us going. So what's a premium? That's the amount you're going to pay each month for the cost of your health insurance. And the only way your health insurance can be canceled is if you don't pay your premium. That's with an ACA compliant health insurance plan. It has nothing to do with a pre-existing condition or how much you use your health insurance. So the premium is the amount you pay each month. So what's the deductible? Deductible and max out of pocket are confused often. So the deductible, it's the amount that you owe for healthcare services through your health insurance plan before your health insurance plan will begin to pay. So a lot of times you'll say, people request, I want a low deductible, but then they'll have, they might have $1,000 or $500 deductible, but their max out of pocket will be $8,150. So you reach your deductible of $1,000 and you still have all this money to pay before you have 100% coverage. So the difference between your deductible and your max out of pocket, there's a percentage called a co-insurance, and that's your share of the cost of health insurance is covered. It's usually 80-20 or 60-40 or 50-50, and that means you'll pay 50% of the bills after you've met your deductible, or 80% of the bill, or 20% of the bills, whatever your co-insurance percentage is, you'll pay that percentage until a total of your out-of-pocket max has been met. So if your out-of-pocket max is $8,150, you're going to be paying 20% of a lot of bills. So the thing to remember as we're talking through this is, you're going to have a big surgery in 2021, or you've got a series of healthcare needs. That max out-of-pocket number is going to be a lot more important to you than the deductible, because that out-of-pocket max is the most you'll have to pay for 2021. A co-payment is a fixed amount, like $15 or $5 or $10 that you pay for a covered health service. Usually it's for a doctor visit or medicine. Adding co-payments to a plan will increase the price. So if you're looking for a way to decrease your monthly insurance cost, getting rid of co-payments is a surefire way to do that. Subsidies and cost sharing reductions, we're going to get into those much more deeply in just a minute. There are two more terms that are important: on marketplace and private market. On marketplace is health insurance that you purchase through healthcare.gov or your state's marketplace. This is also known as Obamacare or compliant health insurance through the Affordable Care Act. Those are all the same things. On Marketplace is the only place to get health insurance that's covered, that's ACA compliant, that covers everything, that cannot exclude pre-existing conditions and includes all of the essential healthcare benefits that are covered by the Affordable Care Act. And we'll go over those in just a minute. Private market is health insurance that is not part of the marketplace. In our area, Farm Bureau is the only health insurance company that offers private market plans that are worth the paper that they're written on. The Farm Bureau plans are actual legitimate contracts between you and the health insurance company. One of the things we're going to touch on in just a minute is what is not health insurance and things to be aware of. Okay, skipping forward. The essential health benefits, these are part of the Affordable Care Act that was passed in 2010 and enacted in 2014 that will go before the Supreme Court tomorrow to determine whether or not the law will stand. I want all of you to hear me loud and clear. Tomorrow, the Affordable Care Act is going to make a decision. It doesn't matter if they send the ACA to hell in a handbasket. Your health insurance for 2021 is going to stand. And there is no way that the Supreme Court would end the Affordable Care Act and dismantle everything that's been done since 2010, because it would absolutely decimate our healthcare systems. So that's not going to happen. It took them 4 years to implement the Affordable Care Act. It will take time to dismantle it. If for some reason the law is overturned tomorrow, I don't think it will be. I think there'll be a severability, a piece where they'll just cut off a piece that's not working. There are a lot of things that are great about this law. There are a lot of things that aren't. For our industry, it has been a huge help to those that are self-employed or part of small businesses. It's the first time our industry has been able to get health insurance. For a lot of our gig workers or 1099 contract employees for the first time in 30 years. So it's been a big deal. These are all the pieces that have to be covered by an ACA compliant plan. And it's important for you to know, as the person who has an ACA compliant plan, that if a doctor says something is medically necessary, it has to be covered by your health insurance. You may have to prove it. You may have to go through a pre-authorization process. But there are so many patient protections that allow you, the patient, to get the care that you need under federal law. So, Tennessee Marketplace. When you are looking at health insurance for you and your family, or just for you, there's something really important to know. When you go to healthcare.gov, that's where we go in the state of Tennessee. You put in your zip code and you put in your age and you put in the amount of money you think that you're going to make in 2021, and it'll spit out about 85 different plans. And most people will choose the cheapest plan. The cheapest plan is not always the best plan for you. It is very important for you to know going in who are the doctors you want to see, and what hospitals do you want to make sure you can go to. Not all networks are created equal this year through healthcare.gov in Tennessee. None of the health insurance plans cover out-of-network benefits. There is one plan that covers a larger swath of the US than the others, and that's Blue Cross Blue Shield. The Blue Cross Blue Shield plans do allow you to see doctors that are part of the Blue Card network. So that's a plus. But if you have the Blue Cross Blue Shield plan in Nashville, it's not accepted by HCA and TriStar hospitals. So it's just important for you to be aware of your boundaries, and knowing those, you can navigate your health insurance, the plan that you're choosing, a lot easier. So here's some, for 2021, this year there's 6 health insurance companies that are participating. Cigna, which is their Cigna Connect plan, Oscar Health, Bright Health, Blue Cross Blue Shield of Tennessee, Ambetter, and United Healthcare. Here is a cheat sheet of each of these plans and the hospitals they play with. So you can see the Cigna plan plays with all the hospitals in our area, but not Williamson Medical. Blue Cross Blue Shield of Tennessee, actually, they do play with Williamson Medical Center, I believe. It's not on here. Those are important things to know. If you need to see doctors at Williamson Medical Center, you need to make sure that those doctors are part of one of these networks. The biggest problem we see is someone who has doctors at Centennial and then they get the Blue Cross plan and they can't see their doctors at the Frisk Clinic, things like that. So just be very aware of these networks, and it'll make it a lot easier for you to navigate down the road. With an emergency, if you are, I don't want these networks to scare you either, but if you're a musician or tour manager or somebody who's on the road a lot and you have an emergency in Timbuktu, Florida, your health insurance has no network. You can go to the emergency room, but it truly does need to be a life-threatening emergency. And that includes stitches or a broken arm, something like that, that can't wait until you get back to Nashville. If it is something that can wait, it's important that you call your doctor, figure out what to do, and get back to Nashville, because they will ding you if it's not truly an emergency, and you'll be on the hook for that cost. So the cost, how do you figure out what the cost is when it comes to the Affordable Care Act? Because these plans do give you some discounts if you qualify for them. So what you pay depends on 5 factors. The category of plan you choose, and starts with bronze, that is the lowest cost, but also has the most limited benefits, meaning you pay a lot more out of your pocket before the insurance kicks in. So there's bronze, silver, gold, and platinum. Whether or not you qualify for a subsidy, and a subsidy is assistance with your monthly payment. And if you are single, a family of 1 in the state of Tennessee, and your income, your adjusted gross income, and we'll talk more about this too, your income after your work deductions is below $51,040 projected for 2021. And that's your income minus work deductions, so mileage, your home office, things like that, not your personal deductions. If your income's below $51,040, you'll qualify for a subsidy. So some of your monthly costs will be reduced. Where you live in Tennessee, if you live in Dixon County versus Davidson County, there'll be a price difference, and you'll have different insurance options than you do here in Nashville. Your age and whether or not you smoke. You can be charged up to 50% more for your monthly premium based on tobacco use. It's not usually 50%, but it's really important to be truthful if you do smoke, that you disclose that, especially with COVID and its impact on respiratory issues. All right, so these are the levels that we mentioned. The most important thing to remember here is the silver plan. That's the only place where you're going to get cost sharing reductions. And cost sharing reductions can be super helpful. Let's see. I'm going to skip forward and we'll go back. All right, cost sharing reductions they are the reduction of your out-of-pocket costs, like your deductible, co-insurance, and co-payments for those that fall between 100% of the federal poverty level. So for a single person in 2021, that's $12,760. So if you make $12,760 up to almost $32,000, $31,900, then you will qualify to have some of your out-of-pocket cost absorbed by the federal government, and you don't have to pay that back. it's super, super helpful for those that need it. And that's what it's put in place for. Now, your monthly premium cost reductions, those are available for 100% to 400% above the federal poverty level. I'm going to show you a chart in just a second, because this gets really confusing. But if subsidies are also called advanced premium tax credits, so the federal government is giving you a tax credit or a loan to pay your monthly cost for health insurance based on the income that you've projected, the income that we haven't made yet for 2021. In our industry, that is virtually impossible to do because we don't know what's coming. I mean, in January, you may have no income, and in May, you're going to be on tour with Clapton on salary. So what we suggest doing is looking at your income in 3-month increments. So when you're setting up your plan for 2021, look at what your January, February, March income will be, and then your April, May, and June, and so on, unless you know for absolutely certain that you're going to have a big income fluctuation. We suggest you shoot low, also knowing that you will have to pay back any subsidies that they loan you, and then you make more than you've projected. So because it's a tax credit, when you file your taxes in April of 2022, you're going to have to pay back the money that they gave you that you didn't qualify for. It is in, oh, my brain just checked out. It's in prorated amounts. So, you know, if you got a $1,700 tax credit and you projected that you were making, let's see, 25,000 and you made 49,000, you're going to have a prorated amount to pay back. But if you go over that threshold of 51,000, you'll have to pay it all back. So it's really important to know what your boundaries are, because in our industry, we do have the ability to deduct things that some people don't. Well, everybody can, but we have a lot more being self-employed in our industry. So you can put money into an IRA, or there are lots of things. So I would absolutely ask an accountant. All right, let me get back to, let's see. There we go. So income. When we're talking about income and the Affordable Care Act and your projected income, what they're looking for, and this is what trips people up in our industry all the time, they're looking for what's called your MAGI, your modified adjusted gross income. So what that is your income minus your work deductions. You can Google MAGI, and it's your adjusted gross income, but also it includes foreign income, non-taxable Social Security benefits, tax-exempt interest. That gets into the weeds. For most of the people that we're working with, it's really your income minus your work deductions. That includes equipment. I mean, there's so many things that we don't think about. So Google it and really think about what you're going to be making. We hear so many people who call us who actually projected so much higher than they are actually going to make because they didn't think about those deductions. It can really help your monthly cost. So Google MAGI or talk to your accountant to figure out really as closely as you can what's your adjusted gross income. Here is the breakdown. So you can see this is for 2021. Let's just look at a family of 4. So if you have a family of 4, you're going to qualify for subsidies if your income falls between $26,200 and $104,800. Again, that's your adjusted gross income. If you have children that are below the age of 19 and your income falls between 100% and 250% of the federal poverty level, your kids are going to qualify for Cover Kids. It's like unicorn health insurance for kids. I know you hear the terms entitlement or welfare or whatever, just throw that out the window right now. The federal government has a program to ensure that children get access to the absolute health care that they need. And the Children's Health Improvement Program, CHIP, in Tennessee, it's called Cover Kids, has an incredible program for children. It covers dental, everything that your child could possibly need. So we highly recommend it if it's something you qualify for. If you as a family, if y'all fall below 38% above the federal poverty level, the whole family will be covered by TennCare. Now that's a different ball of wax. It's free coverage for the whole family, but you want to make sure your doctors are covered. There are a lot of things to look at, and we'll be glad to help you with that. But this is really just a cheat sheet to help you so you can see where you fall. What are your limits? I mean, if you're projecting $32,000 for 2021, you could project $100 less and you would qualify for cost sharing reductions, which the federal government would pick up 73% of your out-of-pocket cost if you just took $100 off your projected income. So that's why these numbers are important. They're further into these slideshows. It will show you exactly what those limits are, so you can have this to help guide yourself if you need it. This is the subsidy qualification, just so you can see that reduction of your monthly cost. These are your thresholds. So this is kind of a cheat sheet for you. And here it is for cost sharing reductions. So you can have these two. And again, cost sharing reductions are a reduction of that out-of-pocket cost. Now, picking a plan. And this is important with group health insurance. It's important with individual health insurance. There are 3 things you need to know when you're picking a health insurance plan. One, are your doctors covered? Who are your doctors? If you don't have doctors and you don't care, then check that one off. What are your personal health care needs? Do you take a medicine daily? Do you think you may be diabetic? Are you in the throes of cancer treatment? I mean, all those things are really important. And then understand what's your budget? Truly, what can you afford to pay? Because that's going to be really important in deciding what threshold you choose with your health insurance options as well. So while this is so confusing and so much information, there are 3 basic things to remember, and that's your needs, your budget, and the health insurance network where your doctors are. You can remember those 3 things, you're going to sail through this process. And then most importantly, you are not alone. You can call Music Health Alliance and we will guide you through this process. And we do it a lot slower than I'm doing it right now. I'm trying to get a lot of information out at one time. All right, this may be the most important slide of this whole presentation, and that is what is not health insurance. On a weekly basis, we will have a client call who thought they had health insurance, and they will have $500,000 of medical bills, or they can't qualify for the transplant list because they don't have compliant health insurance. Medi-Share. I'm going to say this out loud, and I know that it's being recorded, and I cannot tell you how important it is to remember Medi-Share is not health insurance. You hear it advertised on every Christian station as if it is the second coming of Christ, and it is not. It is about the most un-Christian sales gimmick that exists. Medi-Share is not an insurance policy between the person purchasing it and the company. There is no guarantee for any coverage. They make it all shiny by covering a lot of upfront things like doctor visits or your medicine. But there is no guarantee that if you need a hysterectomy, or you have a miscarriage and need a D&C, or you are diabetic and lose a limb and you are not diagnosed with diabetes until after you sign up, that they'll cover any of those things. So stay away from those. Their costs are really similar to the bronze health insurance plans, and you would be much better off with a bronze plan than one of these plans. Unless you are squeaky clean, healthy, and have not a worry in the world, I would stay away from Medi-Share. Short-term plans, they're great, but they're only good for temporary use. It's good if you're in a bind, but if you get a short-term plan for 3 months and in that window, you're diagnosed with cancer or a heart murmur or pre-diabetes or whatever it is, you will be ineligible to renew that policy because it's not ACA compliant. It does not cover pre-existing conditions. So you need to know that going in. We hear a lot right now, people are pitching hybrid plans, and that it's a short-term policy that has a copay plan tied to it, that has a association benefit for discounted drugs, and that's why they're called hybrid, because it's a bunch of stuff all piled together. Those are not ACA compliant health insurance plans. Again, the cost of all that hybrid stuff is about the same as a bronze plan. You're better off going with the bronze plan. Discount cards, you hear those all the time. Those are not health insurance. The only discount program that is really good and worth looking into is GoodRx. And it's an app you can get for your phone that anybody can get, and it will show you where the best cost of medication is for your particular prescription. A lot of times it's cheaper than your insurance. So we recommend that everybody take a look at it, and it's free. GoFundMe accounts, those aren't health insurance. They can be super helpful if you have a medical crisis, but don't depend on those as a fail-safe for access to medical care. None of these things have coverage for pre-existing conditions. They all have internal limitations. So if you do have to go this route, read the fine print and just understand your risk going into it. It's super important. In Tennessee, non-compliant plans, those are plans that aren't purchased through the marketplace. The only one worth the paper it's written on is Farm Bureau. With even the Farm Bureau plans, you have to be healthy going into it. So young, healthy families, it's a great option. If you have any sort of pre-existing condition, it's not the right path for you because they will exclude that pre-existing condition. We have learned with COVID, call us if you are concerned about COVID, call us and we'll talk to you about that prior to applying for Farm Bureau. But with the Farm Bureau plan, it does have the Core Choice plan has wellness visits. It has copays to go to the doctor. It does not have copays for medicine, but it's a contract between you and the health insurance company. And the guts of this policy exist, and they are good and they are solid. And the company time and time again has performed as the contract states. And in addition to, they will fight on behalf of the patient. We've been really impressed, and we have no ties to any of these companies, and we're completely objective. So it makes me happy to be able to say that about a company that is not an Affordable Care Act compliant plan. They're doing this on their own because it's the right thing to do, and that's nice to say. The short-term plan that's the best in our area is the United Healthcare short-term plan. It also performs as written, so you know what you're getting into up front. Now, enrollment through the Affordable Care Act, through the marketplace or healthcare.gov, you go in, these are just the steps. You go in and you create an account. You'll have to verify your identity with some really strange questions that they pull from the IRS, from credit reporting agencies and the DMV. Then you apply, and they ask you lots of questions about your income and your household, and then you pick a plan and then you enroll. It's pretty straightforward. There are lots of questions. They ask 4 times if you have, if you're incarcerated. I don't know why. It's something that's been there since the beginning, and I don't know why someone in jail would be applying for health insurance, but alas, it's still part of this process. There are a number of questions that are optional. You don't have to answer the optional questions. Just make sure you're comfortable with everything you're answering. It's all bound by HIPAA, and it's compliant and very secure. That's been our experience so far. Just some other notes to remember. Medicaid in Tennessee, we have not expanded Medicaid in our state. And this is a political, it was a political decision. And that means that if you are single, no children, no dependents in the state of Tennessee, and you make below $12,760 after your work deductions, which is for 2021 in our industry, it's going to be a lot of people. There are no health insurance options for you in our state legally. What we suggest, if you're close to that line, go ahead and apply for health insurance. And if for some reason you don't make what you project, you are not going to have to pay back those advanced premiums tax credits. We only would suggest this if you're really close to that line. If it is obvious that you're going to be way below, then we would help you look at free healthcare options in our, in our area. The federally qualified health clinics, United Neighborhood Health is amazing here. We'd work with you to understand what the nonprofit hospitals are and what your risk is in that, and navigate you through it. The biggest thing to know is you are just never alone. I mean, if you have a health crisis, do not feel like because your income is low right now, especially with COVID and the loss of employment, you are not alone in this process, and we will help you gain access to the care that you need and deserve. Medicare and senior care. We have a certified senior advisor who is is Music Row royalties. Sheila Shipley Biddy is our COO, and she's our certified senior advisor, and she is a whiz when it comes to Medicare. Her contact information is listed here. If you are over 65 or nearing the age of 65, you can go ahead and sign up for Medicare 3 months before turning 65 or 3 months after. You have a 6-month window to sign up. She can explain all of the ins and outs and the differences between a supplement and an advantage plan. And if you're on a group plan, when you're turning 65, what are your options? Do you need to take Medicare? Do you need to stay in the group plan? She can explain all that to you in such a easy to understand way, and help save you from the deluge of mail that you get about every plan that's the greatest thing since sliced bread. She can help you navigate through all that, and she's super fun to talk to. Group health. Music Health Alliance does have a group health insurance program. We work with a lot of artists who want to ensure that the bands, their bands, anyone that they have on salary, a lot of small businesses. If you want help navigating the group health insurance process, don't hesitate to call us. There are commissions associated with group health insurance. So any commissions from group health and the businesses we work with, those commissions go straight into a fund called the Cowboy Jack Clement Fund. And that fund is actually what enabled us to create our COVID relief program and offer food resources to now over, we have provided almost 1 million meals to musicians across the country. So what we do, how we differ from any agency is we don't depend on commissions for revenue. So when we're looking at options, we're looking at what is best for you. And then all of your employees have access to our advocates who navigate them through their specific healthcare needs. So it ends up being a really great partnership for all of our group employees. Now, health hacks. This is always fun. I mentioned that you don't ever have to navigate this alone. I mean, if you are uninsured and you need insulin, there are resources, lots of them. The Dispensary of Hope is an incredible resource for uninsured and underinsured who have limited income. They have a great website. Check them out. Don't go without medication. GoodRx, as I mentioned, is a phone app. They have a great website. Look and see if you can get your medicine at a lower cost. There's no downside to it. Publix, Kroger, a lot of these grocery stores, Publix, for example, it offers free generic oral antibiotics. I mean, this is the list of them. It also, they offer a 90-day supply of metformin, lisinopril, inhalers, and make no mistake, I mean, their pharmacies are always by the milk, eggs, and dairy for a reason, because you aren't going to go get free medicine and not pick up some sort of grocery that you need. But it's an amazing resource for the public. Kroger does it too. Walmart, Sam's, Costco, they have great generic medication clubs. And also when you're, if there's something, if you have a high deductible and you need a knee replacement, you can always work out a cash pay discount. Cash is king, and everything in the healthcare world is negotiable. We all get white coat syndrome when we walk into a doctor's office and all of our decision-making ability is taken away. But medicine's called to practice for a reason, and these are just people, and they are doing the best they can to answer your questions, but ask them. And just because you get $100,000 bill does not mean you have to pay $100,000. Everything is negotiable. There are thresholds for financial assistance at every nonprofit hospital, and even most of the for-profit hospitals. Now, if you can afford to pay your bill, do and negotiate it as best you can. But for those that can't, we can help you navigate that process, especially right now when there's such scarcity within our industry. And then for our help, if you need our help, we are here, and we are in the throes of open enrollment right now. So please call our main line 200-6896 or send us an email at info@musichealthalliance.com, or you can go straight to healthcare.gov and submit an application, whatever you're comfortable with. We want to make sure that you have what you need. And that, in a nutshell, is where we are. Okay. Oh, Scott, you had to ask that question. So if y'all have any questions, please, please go ahead and put them into the chat. I think that's going to be the best way to answer. So the question is, how does our service compare to PenCoast Benefits, another CMA partner? And no, we are not direct competition. PenCoast is great. They are an insurance agency, and they've been doing this for years. You are welcome to go straight to them for help. We're a nonprofit, and we are all advocates. So while we're all licensed agents, we don't depend on commission for our business. I mean, we are truly a nonprofit. So what we do is very different. We handle a lot of advocacy need and difficult scenarios navigating through the process, but we do not care if you go to us or if you go to PenCoast, you're going to get good service any place. And if you go to PenCoast and you have a healthcare need that you still need advocacy help with, we'll be here to help you with that too. So it is two really different things, and we are fans of PenCoast, and those guys, they're good guys. So any way you go, you'll be fine. Does anybody else have any questions? I know that was a ton of information in a very short amount of time, and we'll make sure that anybody who wants it gets.
Tatum, I have a question for you. Like, what from you kind of walked through a ton of things. If everyone was to leave the call today with knowing one thing, what is that one thing from your perspective?
The most important thing is you should never, ever go without access to healthcare. if you feel like, even if you feel like you can't afford it, there are resources somewhere. So that's one. Insurance wise, insurance gets so, there's just so much information coming at you at one time. It's hard to even know what to do. So remember those three things as you're trying to pare down what plan is right for you. And that's, what are your medical needs? What's your budget? And where are your doctors? Answering those three questions will take you right to the plans, usually 2 or 3 of them that will meet your needs.
And something that I don't want people to just assume, but when someone calls you and to talk about their healthcare needs, it is completely confidential.
Oh, totally. Absolutely. We are bound by HIPAA at every angle. It is, it's meant the difference between us getting big grants and not getting big grants, because our files would have been the property of the federal government or this program or that program. And it is a non-negotiable. We are bound by cybersecurity. Lots of steps of cybersecurity. We're bound by HIPAA. And it's the foundation that we stand on. And if we were not a safe place to go, we wouldn't have been able to build the nonprofit that we built in the last 8 years.
And I think too, everyone should know that there's no like dumb question when it comes to healthcare. It's a very complicated, convoluted thing. So they shouldn't be nervous to call to just ask questions, right?
Oh, absolutely not. And Samiko just submitted a question that, and she's absolutely right. We have a fund at Music Health Alliance called the Ben Ostone Fund. And Ben was a 28-year-old drummer who played with Margot Price and Elizabeth Cook, and he was beloved. He worked at this 5 Spot to make ends meet. And in 2017, he called, well, it was like, December of 2016, he called healthcare.gov and said, hey, I need to get health insurance. This was a drummer who always filed his tax return. I mean, that's how unusual he was. Not many drummers say that. He called and he said, yeah, I'm going to be making $30,000 that's my projected income for 2017. They were like, okay, your health insurance will be blah, blah, blah. He gave him his gross income, not his adjusted gross. He hadn't taken out any of his deductions, but he didn't know that was even a thing. So that's important to know when you're dealing with healthcare.gov, because they aren't going to tell you that. So they said, oh, your insurance will be $350 a month. So he's like, I can't afford that, but I know the free clinics. I know the I know the nonprofit hospitals. I'll be fine. Fast forward to April, he started having some abdominal pain, and he went to one of the free clinics and they said, oh, you've just got impaction. You need to take this suppository and some laxatives and change your diet. A few weeks later, he goes back with the same problems. They tell him the same thing. Fast forward to May, he's in the emergency room for the second time in severe pain. And because he has tattoos and long hair, he is triaged as an opioid addict. I mean, this guy had never taken an opiate in his life. And he is sent home without any abdominal scans. It gets to June, he's back in the ER, and they finally do an abdominal scan. They find a mass, and they think that it's an abscess because of the suppositories he had been taking. So they didn't do a colonoscopy, which he had been asking for since April and would have cost only $1,200. They did an abdominal scan and they drained this abscess, but didn't see anything else in his colon. Finally, he has a colonoscopy and they found blockage, and they immediately do a biopsy, and it's malignant. He has a tumor in his abdomen. So this was June 22nd, I believe. He is told by his surgeons who did the biopsy that he needs to call the oncology department and set up a time to meet with an oncologist to get treatment started. So that's end of June. July 6th, he still hadn't heard from anybody. So he calls to find out why he hadn't heard from anybody yet. And they say, oh, wait, you're uninsured, aren't you? And he said, yes. And they said, well, we're going to have to send your case before the tumor review board to see if we can take it. We'll be back in touch. And on July 12th, he ends up back in the emergency room, unconscious. The tumor was growing so fast that it had ruptured and he was septic. And I can't even tell this without just losing my mind, because it was such a preventative death. On July 12th, Ben Stone died, a completely preventable death. I mean, it may not have stopped his cancer, but he would have had a fighting chance. And all he needed was access to a $1,200 colonoscopy. So we had an appointment with Ben on July 12th, and he didn't show up, but we didn't know. We just thought we were helping him with medical bills. We didn't know any of the history. So we got to know his family, and they had a very clear medical malpractice suit at about 5 different turns. And they chose not to pursue that route because they wanted Ben's memory to be encapsulated with the beauty of the human being that he was. So they took the remainder of the GoFundMe account, and Dirk Bentley matched it, and St. Thomas matched the funds that we had raised. So we started with $75,000 to start the Ben Stone Fund at Music Health Alliance that provides diagnostic care to uninsured and underinsured people in the music industry. And since its inception, we launched it in March of 2018. There have been like 84 lives that have literally been saved. People that maybe needed a second opinion or couldn't get care and knew something was wrong. And that's the goal of this fund. If you in your gut know something's wrong and you can't afford to get the care that you need, call us. We have a super easy application. We'll walk you through it even. But no one should have to go through what Ben did, and then that his family continues to go through day in and day out. And we worked with a group of physicians to review his medical records to determine exactly what the total cost of care would have been to get him into the hospital for surgery. And that's where he would have qualified for financial assistance at the hospital. Total all in for the colonoscopy, other imaging, doctor visits, labs, $3,500. So the Ben Stone Fund will provide up to $3,500 in diagnostic care to help you find answers. So thank
you for sharing that, Tatum. I was not aware of the fund, and I think it's something that people, I think healthcare just scares a lot of people, and they don't really know where to turn. And you all are the greatest resource our industry has. I so appreciate you sharing that, and for just being an advocate for everybody, insured, not insured, wealthy, not
doesn't
wealthy.
matter. I mean, we just want
for
to be
everybody.
safe. Yeah, there's no dumb question. I mean, we all have them. Healthcare does not discriminate. We want to always be a safe place where you can go and get answers. And if we don't know the answers, and goodness, we don't know a lot of them, we'll help you find them.
Will you just close today's session, unless there is another question, with just what you are doing right now in terms of COVID relief, so that way everybody knows that they may know you as one organization doing one very specific thing, but I think that your relief efforts have been incredibly inspiring. And so making sure that they're also aware of some of the stuff that you're doing, I think would be really helpful.
Sure, absolutely. When in mid-March, when COVID, we started to realize that this was going to impact our industry significantly. We realized that because the phone calls that we would get asking for help navigating a healthcare issue shifted immediately overnight to, I need help getting food and diapers and formula. And it wasn't one call, it was 50 within a 2-day time span. So we went back to the drawing board, understanding very sincerely that food being the greatest, the most fundamental piece of healthcare, that we needed to do something to help. And we didn't have a lot of money, so we needed to make the money that we had go far. So we decided that food resources, gift cards would be the way that we could help the most. But in the same thing that we do with healthcare, we'll look at your specific scenario and need and help find all the resources around you and connect you with those. So while this food gift card was a place to start, if it was a music maker in New Orleans, we would help him first. Food was his first need. So we'd check that off for the month. And then we'd ask about, and we spoke with every person who applied. And that was a big deal because we got to know what their needs were. And the goal being, after 2 or 3 months, we want them to be on their feet again, to be able to function and not have to leave the music industry, just kind of come up with a plan to help them get by. So say for this young musician in New Orleans who needed food, he also needed help with his utilities and his rent. And it was so much that he felt like he couldn't breathe. So we started curating a list of nonprofits in all of our music cities: New Orleans, Los Angeles, New York, Chicago, Miami, Nashville. And we would connect him with his local resources to help with those next things, and then ask that he reach back out the next month if he still needed assistance with groceries. So we had about 50% of the clients reach back out for a second card, about 20% for a third, and almost none for a fourth. And what we learned is there was a great sense of empowerment, learning to fish for yourself, but navigating those needs and then helping other people navigate what they had learned. So for us, it was a great way to make a small amount of money go far. So right now we still have food gift cards to Kroger and the Kroger family of groceries. We just ran out of Trader Joe's for the year, but we'll have more in 2021, and Walmart. And those can help with medicine and gas. I mean, whatever it is that you need. And we've just learned that some other music nonprofits are going to be doing the same thing for the holiday season, which is great because our 2020 funds are going to run out and they're going to be able to pick back up so we can start again in January. And I'm so hopeful that by the spring, we'll all be able to go back to work. We got some good news today about a potential vaccine. So I'm just so hopeful that it's real and it's as good as we hope it'll be. Even if this one is not, there are 2 more coming up the pipe. So that's our COVID relief in a nutshell. And it's fluid. And I think like everybody else in our industry, we're trying to figure out what we can do to help keep our industry above water, to make it through the season. And it is a season. I mean, it's going to end.
I so appreciate it. Well, I thank everyone for your time and allowing Tatum to educate and inform us on this Monday during CMA Awards Week. But Tatum, as always, it is such you're such an incredible resource and asset to our community. We are very lucky to have you and Music Health Alliance, and really look forward to continuing our partnership. And I cannot say this enough. I cannot say it loud enough. Please tell your colleagues about this incredible resource. Encourage them to have conversations when it comes to their health and their health care. It is so important for every reason that Tatum has shared today, but certainly we as a trade association for the genre, and Tatum as an advocate of a nonprofit, like, your healthcare matters to us. And so it's incredibly important that we create pathways for you to find answers and ultimately, take ownership of your healthcare needs. So thank you, everyone. Tatum, always a pleasure. I cannot wait for the next call, and we'll talk to everyone soon. Have a great week, everyone.
Y'all too. Bye.